very much like to welcome Ross and Jenny. So if you could just introduce yourselves, and I will hand over to you guys.
Thanks very much, Rachel. So my name is Ross Bailey, and I'm a social care analyst at Sandwell Metropolitan Borough Council. And I'm part of another network, which is the Performance Network, which is initiated by West Midlands ADASS, as Rachel correctly said at the start. And that Performance Network made up of several local authority analysts that work within social care. And we've been supporting the national team, which I'll hand over to Jenny to tell you more about, with a statutory return called the client level data collection for a number of years now. And we're here today to give you a brief overview of that. And before we do, I'll hand over to Jenny to introduce herself.
Thanks both, and hi everyone. I'm Jenny Neuburger, and I lead the team within the Department of Health and Social Care that is responsible for the sort of developing the data collection from the sort of national side, and working really closely with our delivery partners. So that's NHS England, sort of a national team there, and also Arden and Gem Commissioning Support Unit, who operate the collection on behalf of, working closely with all the other commissioning support units, and closely with Ross and the reference group, which is the client level data reference group, which is local authority analysts and data leads who contribute to the project, and also quite closely with LGA and ADASS, particularly in the coming year on some of the development work. So it's sort of developing the data collection itself, and sort of trying to start, particularly in the coming year, using it, sharing it back, analysing it in sensible ways. So great to be here.
Right, so as Jenny said, the ADASS Performance Network had put forward a volunteer. I was the volunteer to support the reference group with the client level data return. So I've actually been involved in this process for probably nearly 5 years now, and I've been working with Jenny since she's been heading up the project. And it's been really interesting time, really, as we've seen the specification develop over the years to be what it is now, which is the release 1. And the specification's available to everyone, and we'll circulate the link for that at the end. And there's also detailed guidance that sits alongside it, which is a 65-page document. It does provide some really useful guidance to adult social care analysts as to what we need to submit, and also has the flexibility that's required because of the various ways that local authorities structure their adult social care departments, which is one of the complexities with this particular return, because we often do things slightly differently, or we have different systems, IT systems that is, that we record our data on. So I'll start by sharing my screen and just give a quick overview of what we're going to cover off today. Okay, so could I just get a quick thumbs up that you can see that, please?
Yep.
Yep. Okay, great. Okay, so we're going to have a look at the structure of the collection.
So Ross,
yeah.
Ross, I don't know whether you wanted it. We can see it perfectly fine, but it's not in presentation mode.
I can put it in presentation mode. Yeah,
I don't know.
I don't get to see your lovely faces.
Oh well, it's your choice.
Yeah, I think I'll prefer it to be as it was, if that's okay. Let me try to.
Yeah, absolutely, go for it. We can see it fine.
Okay. It just helps me with, if I can get out of that now, just gauging your reactions. And I know I can only see your reaction at the moment, Rachel, but it does help. And I can also see my third screen, which has got the detailed specification on when I do.
Sure.
Okay. So, thank you. So yes, structure of the data. So we're going to have a look at the structure of the data today. We're going to look at a stylized view of that, so we can see the overall concepts which the client level data return is trying to capture. And then we'll take a look at the template, the submission template as well, which is obviously more detailed and has all the 50+ columns of data. I'm not going to delve too much into the nuances of every single field because it is only an introduction, and some of the issues that we are trying to wrangle with are a little bit dry. They're technical in nature, and obviously adult social care analysts will be very familiar with them, and in time I'm sure health analysts will also become more familiar with them. But it's just the overall concepts that we're going to have a look at today. So we want to understand the types of data that are being collected, and essentially what we're intending to do with them initially and then over the long term, which Jenny will give us an update on for the projects. Okay, so what is the client level data return? So the client level data return, this collection essentially covers the main events that a adult, that is a client that receives social care, or their carer receives in a particular reporting period. This collection came into effect, well, was mandated from the 1st of April 2023. So we've now done 2 collections. It's a quarterly submission that local authorities make, and it's also a cumulative submission. So our latest submission would have covered the period April to the end of September 2023, and we're looking at various what we call events that have occurred during that period. So the 4 main event types that we cover are requests, which are, I guess, essentially similar to contacts that are received either by the client themselves. So if we've received a phone call from a service user, or their representative, so they might have a carer or family member that's phoned on their behalf, or other professionals that might be making a referral to social services, and that could be someone maybe from a hospital hub, a team where they're informing us that there is a person in a hospital bed that may require social care on their exit. And local authorities got various different ways of capturing those contacts, and as you can imagine, we have several of those contacts that we receive every single day. And just to give you a flavour, if you were to look at the Sandwell activity, you're looking at in excess of 10,000 contacts that we get every month from people that are contacting us about social services. What we have to do with that data is try to determine what is a request for support and what is a unique request for support, which is a challenge, as we often get subsequent contacts that relate to the same issue. And what we're aspiring to submit as part of this collection is a single request that is unique in nature. So that in itself is a difficult thing for us to work through. We've also got this concept of assessments. Again, local authorities that deliver social care have different models of assessment. So some have what you might have heard of, which is a 3 conversations model. Others have outcome focused, strength-based approaches that are not mutually exclusive, obviously, those things. But we've got different approaches to undertaking assessments, and there are also different types of assessments that social care undertake. So you can have assessments for eligibility for services, which is eligibility under the Care Act. And we also have assessments for occupational therapy, so that you might go on to get an aid or an adaptation to your home, and that will be a different assessment type as well. There's also a distinguish between what's a long-term assessment and what's a short-term assessment, and that is more to do with the nature of the service that may follow. That's a category. And then we come on to the response to a request for support. Those are described as service events. Service events are again categorized. They can be those services that you might deliver in your own home, and those that you might be delivered in a placement setting, such as a care home. And under that category, there are components of service. Components of service might be home care, daycare, items of equipment, as I mentioned earlier, or professional support from a care professional. So with regard to services and service data that we see within the client level data collection, there are again a number of ways which local authorities record that information in their system. A care package might be made up of multiple service events. So we would see multiple rows of data for one individual that receives a variety of different services as part of their care package. So that could include maybe home care or daycare and equipment. So within the data set, one individual might have multiple rows of services listing each of those different components individually. But even within a service type itself, it might be made up of multiple rows of data because there are different providers delivering that particular service. So something like home care, for example, could be delivered by 2 providers, even for the same person. They've got somebody different going in over the weekend as they have Monday to Friday. So again, you can start to envisage the complexities that come about when you want to take an analysis of this data. We then have this concept of a review. So a review is a review of a care package or services. So primarily reviewing the long-term services, but we've also got the opportunity now to submit reviews for our short-term services as well. Short-term services would be things like our reablement offer, those that promote independence, and other services which are short-term in nature, like a short-term placement to a care home. Okay. So that was the stylized view. That was the simple. And then we get into the more detailed view of the data there. So what we see here are all the different categories of data that we have. So within the collection, which is a flat file that we submit to RGEM, is a section on the local authority. So we have to submit the code. So each of the local authorities has got a unique code. We submit that, and then we have our reporting period as well. So as I say, this is a cumulative return, and we make a quarterly submission at the moment for that. There is, I think, the facility to do that more frequently on a voluntary basis, but it is quarterly, which is mandated. We've then got information about the person. So as you can see on the screen, we've got details about the person's NHS number, their first name and last name, GP practice, gender, ethnicity, date of birth, date of death. Client type, primary, and client type is whether they are a carer or a person receiving services. And then we have this concept of a primary support reason. Primary support reason are things like whether the person has a learning disability, a mental health condition, and if they're receiving support because they have access and mobility issues or personal care issues. There are several, but those are the main ones. And they differ, the concept differs to health conditions. So this is the primary reason they're receiving social care support. So it's not the case that you could have your primary reason of support as memory and cognition, and then you could also have health conditions that are also listed on the return as well, which are in the specific section here about whether they have a visual impairment, hearing impairment, dementia, so on. So this information obviously is containing personal sensitive data, and the process which anonymize that we'll come on to later. Just to reassure those people that have got an interest in IG that that's not exposed to people that it shouldn't be. We've also got other fields in there around the carer's information. So where we have got support being delivered to a carer, one of the things that we try to understand is the connection between that carer and the person that they're caring for. So we might be looking at things within the data, such as what's the combination between maybe the age of the carer and the age of the person that they are caring for. You can envision doing some quite useful analysis there if you've got an aging carer population. Obviously, when that support goes away, they're going to turn to the local authority for more support. So real opportunities there for some more detailed analysis around that area. And then we've got these the events details. So for all of the events, we're looking to capture the start of the event and the end of the event and the outcome of that event. When it comes to capturing the event outcomes, this again is a complex area of analysis. The national team are undertaking a very complex job to look at how to transform the data to determine what the sequel to a request is. This is a very challenging thing to try to achieve, particularly at a national level. At a local level, lots of work is undertaken by analysts to derive that, and they have the facility to be able to look at the local social care system as well. So the transformations that the national team will undertake, obviously they haven't got that ability to look at the local social care system. So they are transformations that are going to be, what's the right word? So they're going to be systematic transformations that will be documented and made available to local authorities so we can understand how they are being derived. This is where we're trying to understand where from one request there might be several responses that the local authority provides, and what we're trying to understand is what is the greatest response. So if somebody has maybe reablement and an item of equipment, within that offer you would say, well, they've had short-term support to maximize independence, and we're also then trying to understand what the outcome of that reablement service was. So did they then go on to receive long-term support, or did they actually no longer need support from the local authority? And tracking those sequels, as I say, is a very complicated process, and the national team are doing a great job at doing those transformations. But further work does need to be done with the local authorities to ensure that we've got a similar result to what we're seeing within our current return, the SALT, which I don't know if people are familiar with, but I will talk about it a little bit more, which is an aggregate return, which is what the local authorities are working out themselves. We've also got within this a specific section on services, because services is going to be a really rich source of data, and that tells us information about the provider, and also sections on costs as well. So the unit cost of provision, the frequency of that provision, and how many units are being delivered per week. And then for reviews, we want to see the reason why someone's had a review, and that could be because it is a scheduled review. The local authority will have a duty to undertake reviews for everybody receiving long-term support, as defined in the Care Act, once every 12 months. But we also have unscheduled reviews. This is where the client may approach the local authority before that 12-month period and request that their needs are revisited because they've had a change in circumstances. Maybe there's been a breakdown in the carer support, or maybe they've had a fall, something of that nature, requiring them to undertake a review. Okay, so moving on, this is the next section is looking at what the processes for submitting the client level data. So each of the 152 local authorities with social care responsibilities will have their own local IT system. Lots of us have got the same IT system, but there are a variety out there for local authorities to procure. Even if you've got the same system as another local authority, the systems are very flexible, and you can implement that system and configure that system in a variety of ways. So what the social care analysts are doing is extracting the information from their system, understanding their local processes and procedures, then transform that data, and hopefully there are limited transformations that are required by the local authority to then submit that information on the template that is provided for the national return. One of the guiding principles is we should limit the amount of transformations that we're required to do, because we're trying to reduce the burden on local authorities and ensuring that we've got consistency of transformation, which is happening at a national level. When that data is submitted, it's submitted to the HMDSU, where the process of pseudonymising the data takes place. And then it is then pushed to NHS Digital, which is now Department of Health and Social Care, obviously, to undertake various things. So I'm sure Jenny will touch on this in more detail than myself, but there are various things that need to be done. Some of the things around trying to replicate the SALT return, which is the aggregate return that I mentioned earlier, being able to calculate things like the ask-off and respond to various other requests that come from ministers and things of that nature. But I'm probably doing an injustice there, and Jenny will give far more detail, because there's lots that have to happen with the data on a national level. So how can we use this data to improve social care and obviously improve the way that health and social care work together? So one of the key uses of the data is, as I've touched upon, replicating the SALT return. So the SALT return is a collection that local authorities have done for several years now. It uses a lot of the same data that client level data is requesting, but we're aggregating that data up into tables. So there are various aggregation tables that we submit on an annual basis to the department, where we can see an overall picture of what's going on within adult social care, such as the number of requests. But we can only see that by categories that are in the aggregation. So it's split between 18 to 64-year-olds and 65 plus. And the outcomes are, as I said, determined by the local authority to say, well, we can't tell you every single thing that this client has got, so we need to use a hierarchy. So if somebody has got equipment and reablement, in the example I've given earlier, we would just say they've got reablement, because that's in the hierarchy the greatest need. So what we're doing here with the client level data return is getting far more nuanced intelligence, so that if there was a requirement to understand the profile of social care service users in more detail, we've literally got every single age of those clients, so we could look at it in a variety of different ways, and not just the 65 plus. We can start to see, have we got an aging social care population by looking at smaller categories, smaller groups like 85 plus. So that's one of the ways which the client level data will vastly improve what we've got now. We've also got within adult social care a framework, obviously, that many will be already aware of, called the ask-off. So the outcomes framework, where there's metrics that have the numerator definition and denominator definition, which is currently derived from the SALT return. So as we're trying to replicate the SALT return, there's also a replication of the ask-off that's required. And again, the hard work is all being done by the national team there to undertake those transformations, and they're collaborating with the local authorities to understand the variety of different ways that we're submitting the data, so that we can have a transformation process that is fit for the majority of people. Okay, so then improving the understanding of social care. So one of the other things that we've got to understand better is the journey through social care, understanding the impact of how different local authorities have configured their social care offer. So can we see differences in the model of assessments with the outcomes that people are seeing? Can we see that whether reablement services are being effective? And we can see this in greater detail now that we can see all of those different events for each person. It also means that we're going to be able to use that data in a more consistent way on a national level. That means that the national tools that have been set up will allow people within local authorities to access the same data in the same way, whereas previously we were reliant on local authorities to have to do a lot of the analysis at client level themselves. They might not have had the capacity or capability within their own local teams to do that. And this enables people to share that data and to share tools across the country to understand their data better. We've also got, as people know, a inspection framework within adult social care, which is undertaken by CQC. So I'm sure CQC will be looking to sources of data like the client level data return to undertake their assurance process. And then we've got finally an aspiration to start linking health and social care data together, which would be done using that NHS number that we saw on the specification. When that's done, we can understand then the relationships of people being discharged from hospital into social care pathways and perhaps back again, and the overall duration of time that may take. And ultimately, the goal of all of this is to improve the quality of care that service users are receiving and the experience that they are receiving from their local authorities. It's going to be really helpful for combining data with other collections, and Care Data Matters is looking at improving the collections route providers as well, so we can better understand that. And it will be a very useful tool for local authority commissioners, ICSs, to benchmark and get an oversight of the market, undertake planning, policy development, and research. Okay, I'm going to stop there and hand over to Jenny. Do you want me to continue sharing, Jenny, and move the slides down?
Yes, please, if that's all right. Thanks, Ross.
Okay.
Right. Yeah, thanks so much. I really enjoyed hearing your description of what client level data is, even though I've been working on it for nearly a couple of years now. So in terms of the project itself, the last year, 2023, as Ross says, it became mandatory for local authorities to return the data on a quarterly basis in April. But in the sort of the few months run up to that, we did an enormous amount of work to try and have conversations about the specification and the guidance. Ross has been involved for much longer than me, and it was, very much kind of developed through the reference group with local authority analysts. Nevertheless, once exposed to a much wider community of all 153 local authorities, a lot of the difficulties that Ross has mentioned in terms of the differences in the way services are organised, recorded, local terminology varying, it makes it incredibly difficult and challenging, but also I think at this point, hopefully Ross is feeling the same, incredibly exciting and rewarding, because this really is transformational. This is the first national collection of social care records, that we're sort of completely a journey, where health was maybe a decade or more ago in terms of sort of setting up kind of more frequent record level data collection, and with the hope that this will not only really improve the visibility of this very vital and expensive area of activity, improve that visibility, but all these opportunities to link to health data, I think, are particularly exciting and really understand and sort of promote integration. In terms of the project itself, so the sort of start of 23 was still lots of discussion about the specification and guidance itself, and then the sort of first set of returns, although it became mandatory from April, the first return was in July, covering the first quarter of activity for 23-24. And then the second return was in October. And running alongside that, we were very much focusing, like Ross says, on the sort of priority was being able to reproduce existing statistics describing social care activity that are widely used in all sorts of areas, that are currently collected via this annual aggregated return, the SALT return. So being able to reproduce them, and that work was led by a team in NHS England, but with an analytical working group, local authority analytical working group. Another focus was on developing a dashboard for local authorities to share back some of this insight and intelligence from the returns they made. And so sort of developing that content and visualizations with local authority analysts. And the third bit was beginning to think, although we're still very much in the sort of thinking and developing stage, and looking at kind of more complex metrics such as the waiting time for an assessment or service. But again, this is very complicated, not just from a sort of technical event linkage perspective, but also this problem of definitions and when is the clock starting and what does a request mean in different local authorities. We've now confirmed that the existing annual return will stop. So we've had this 1 year of running both, dual running. So local authorities will make their final SALT return for data they've collected for this financial year in May. So we'll have a year of SALT data and a year of 4 quarters of client level data, which will help sort of see where there might be differences in what local authorities, when they collate the data locally, given their knowledge of context and the methods they use, or how many requests they count versus how many when we're given the tens or hundreds of thousands of records, how many we count for that local authority. And I think I think maybe move to the next slide, and then I'll do the looking forward bit next. Thanks, Russ. So I think a real tribute to the enormous amount of work that local authorities have done, often with just one analyst working on adult social care, is that we've had submissions from, it is 153, although the sort of 152 made a submission in Q1 and then 152 in Q2. One of the big challenges we have now got, it's a really quite a lot of records, 5 million. So we know, for example, there are 2 million or so requests for social care every year to all local authorities. But we're also collecting the records of all these other events, but really kind of sorting through these to make sure, what might be defined as a new event on the case management system and submitted that way might be in another local authority commissioned. That package may be commissioned all as one service and just come as one line. So kind of really working through, as well as the simpler issues around the completeness and the sort of validity of the data we're receiving. And then we've got particular fields in the specification that we're focusing on that we think are really vital to recreating some of the statistics we need to create, and trying to work with local authorities to improve data quality and recording of those. And a particular challenge is the event outcome, which isn't necessarily always recorded on the case management system, so has to be, there's going to be different ways that local authorities start to fill that in, but that's quite important as expressing an intention of what should happen next. So whether there's no further action expected by the local authority and they're signposted somewhere else, or whether they've been referred for an assessment or straight for a service. I think next slide, please, Ross. We've now launched, in November, we launched a dashboard for all local authorities where they can see just their own data back. So that's sort of got the appropriate information governance and data sharing agreements sitting under it. So that's where, and the sort of content of that dashboard is something that's been developed with the reference group. And I think we've now got more than 100 local authorities have signed up now, and more individual users than that. So that is really great. We are aware, that more people will want to see this, but at the moment it's just for local authorities to see their own data because they know what they meant by a request when they submitted it. They can, and I guess this initial sharing back is just providing useful summaries of the data, but also a tool for them to inspect and improve data quality. I think if we move on to the next slide, so it's time for questions. As Russ described, this work is led by the team in NHS England who we work with closely. But this is the sort of bit where we're sort of trying to come up with some ways of aggregating, you know, filtering, processing the data and the methodologies that are common across the country to sort of produce these summaries that local authorities would have produced and collated and returned before through the sort return. I think we do gain from that some transparency and consistency in the methods, but obviously we lack some of the local context when applying those rules. So they will, you know, sort of trying to come up with some rules that roughly work. So I think that's a really vital next bit of work, or it's been mostly complete and but needs to be finalised early in 2024 because SALT will no longer exist. So we'll need to be able to reproduce those statistics. And I think next year, looking forward to this coming year, I think there's still lots of delivery to do and lots of work around the specification and the guidance. But I think very much trying to move as well towards the let's start analysing the data, testing the linkage to health data initially just to the hospital episode statistics or SUS, you know, the hospital records, sharing the data. So we've done a work in our team with NHS England to try and ensure that the data is in the places it needs to be so that organisations can set up data sharing agreements to access it where appropriate in future. And I think, yeah, and then so I think, you know, and the big ones probably in terms of policy interest within the department are understanding waiting times, although, you know, that we're working very closely with LGA on developing those methodologies, and also hospital discharge is another big priority, which I'm sure you're all very involved in it various ways. So understanding to what extent capacity in social care, all those processes, you know, and the sort of the how well the process works between the NHS and social care, how affects discharge from hospital. And I think I'll pause there so that we can have questions.
Thanks both very much. Well, personally, I've got loads of questions, but there's a couple have been posted on Menti. I must admit, a couple of them are from me because I just sort of might forget. And I do have one in the chat as well from Jacqueline. Now I don't know whether you can see the chat because you weren't part of the poll I did. So Ross can see it. So there's quite I think the person who has appeared on screen is the person who can address this question more efficiently. Jacqueline, do you want to? So you used to work in a local authority.
Shall I read it out? Yeah. So
yeah, do that.
What I wrote was, I just said, I'm obviously getting very old because I used to work in social services, local authority, in social service department, and in the mid to late 90s I was our authority rep on the reference group at the Department of Health that developed the RAP returns, which were stood for referral assessment and procedures. No, not procedures, packages. Referral assessment packages. I've been in health too long. Procedures, referral assessment packages, and it was so difficult then. Locally, we had superb information, superb performance management information reports for managers to assist them with their work, and we had such good information locally. But and I think lots were like that. But nationally, bringing it all together, it was the way that everybody worked was so different that it was really, really difficult. And there was just like these big, long, drawn out meetings at Skipton House that just went on for days, where we were just going over and over. Well, no, that won't work for us. No, we couldn't. Well, what do you mean? How do you define that when you say this? Oh, it was just, and that was just to put together an aggregate return. And I can remember at the time thinking, wouldn't it be easier if we could just give them you know, row by row, each person, you know. But obviously the technology and you know, we were still collecting stuff on pieces of paper then. So my question really, so I was commenting really that I thought that it was really pleasing to see that, you know, at long last, it seems like with this return that it's happening, something that kind of was wishing for 30 years ago. But for me, the relationship between the care data and the health data and that interface and the ability to understand what's going on in order to be able to make important changes to what's happening in the real world around, you know, particularly you mentioned things like discharging from hospital, and that for me is really, really important. And I want to know what the plans are and how you see that aspect progressing in the future.
I don't mind commenting from national, and then Ross maybe, because I feel like there's definitely the multiple levels, aren't there? So I guess nationally, it is a real priority. So we've committed, for example, to mid next year trying to replace some of the metrics in one of the funds to local authorities, the Market Sustainability and Improvement Fund. So they collect data at the moment to sort of monitor sort of what's going on in terms of waiting times. But we've said we'll try to develop, working with LGA and the reference group, develop a metric that is sort of sufficient, that is acceptable to local authorities, ideally, that is some measure of waiting time. And I think we'll try and do something similar. So the ASCOF framework that I guess you know, Jacqueline, but yeah, Ross mentioned, has two metrics which are meant to describe the outcomes of hospital discharge, and sort of, so one is sort of the coverage of reablement, so how many people receive reablement when discharged, and then how many people are at home 91 days later. So that's a sort of collected via SALT at the moment. But I think the plan is that we'll use linked HES or SUS data linked to CLD records to try and not necessarily come up with exactly the same measure, depending on what we can manage to get out of the linked data, but to come out with something that indicates, I guess, both something about both the access to sort of reablement support and its effectiveness in terms of helping people regain independence or remain at home. So yeah, and I think certainly the teams working on hospital discharge are very interested in understanding delays, reason to delay, starting to use the discharge ready date in HES, and then begin to look at that. And I agree with you, it's really important. We're also feeling very cautious because I guess you'll have known from your days or weeks of debate, you know, local authorities would also be very cautious about how the data will be interpreted and used. But Ross, I guess lots going on at the regional level as well.
Yeah, well, I'm really interested to hear you talk about RAP, because it's a bit of a blast from the past, and I remember it well. I actually recall being almost crushed in a filing system where they would move things because I was getting pieces of paper out for the RAP return. It was very antiquated back then, and things have obviously moved on a great deal. So yeah, that was rather amusing when you've reminded me of that. But yeah, in terms of linking with health data, I think it's probably very early days in terms of thinking about that, because the focus has been so much on making sure that the guidance is well understood about what we're submitting for our collections, and also then we're still in the phase of trying to understand how SALT and ASCOF is being recreated. That's going to be the main focus for local authorities. That's not to say, though, that some local authorities haven't already done some work on connecting health and social care data because they have, but I think the vast majority are focused on those initial things. But in time, and this is my personal view, I think it will probably be a conversation where perhaps led through like the ICSs or the ICB analysts, they could look at how we start across the ICS, linking up the client level data returns for the respective local authorities with the health data. And one of the first steps in that process would be clearly articulating what question we're attempting to answer, because I think we're at that stage. We need to know, well, what are the quick wins that we can do from this data, bearing in mind that we have got differences in the way we record and submit the data. There are still going to be quick wins in what we can answer, and that could just be, well, is this person known to adult social care? Whether it's a request that's got a slightly different interpretation by one local authority, or you've recorded them on your client level data return, so they're known to you. And have they had a hospital admission? And that's very, in my mind, a quick win. And then the more detailed analysis of pathways and how long things take are more an aspiration, aren't they?
Thanks for that, both. So there's a couple of questions on the Menti. I won't share my screen because a couple of them are the same theme. One you've just covered off. I don't think we're able to answer the timeline for the potential linkage between data, but I think we understand the complexity of it. I think we also understand that you do have to be so careful because people have been waiting for this for so long. So Jenny, you mentioned health data being at this stage sort of 10 years ago. It's probably about 20 or 30 years ago, if not more. I should know. I think I was there, not 30 years ago. Come on. But yeah, and I think there'll be quite a few people who'll be quite surprised. No offense that you're only at this stage now. But isn't it great that you are? And like you were describing, Ross, the complexity of that data. I always thought health data was complex. It's complex because there are so many different providers and there are so many different types of healthcare, so many different types of organisation. But the particular an individual client record, because it's all in one, effectively, it is incredibly complex. And I'm also seeing it's been brought to life because my father has been through this system now. So the things that you're saying are sort of like there's a shining light on how that can't be recorded in the way that might be useful, from a family or a carer's point of view. And you can see quite clearly when you go through the system yourself. So come talk to me. I've got lots to say on the subject. Is it brings it all to life. So, but the question I'll just sort of finish with, really, and we might have time for one more, is really so that this effectively is going to be a national adult social care client level database. Is that right? Is that and so that obviously there'll be data sharing agreements in place with relevant people and users. So what is the intention for that database? Will there be versions of it that could be accessible by any analyst, for example, who wants to do this type of work? Jenny?
Yeah, I'm happy to pick up again from the national perspective, and Ross might know more about what data sharing arrangements are already set up in the region. But yeah, so it's the collection. There was a sort of the direction from the Secretary of State is that NHS England operates this data collection. So that's
Okay.
sort of, so what was NHS Digital, now NHS England, because they've sort of merged. And so it can be, in terms of, once they're sort of moving it now into the secure data environment.
Okay.
So in some where it'll fit, it can be accessed there. But obviously any organisation wanting to access it there would need to apply through the Data Access Request Service, DARS, NHS England, and have the right, you know, set out their purposes for wanting to access the data and have a
Sure.
data sharing agreement in place. So that's the route through which a wide range of organisations, including the Department of Health and Social Care, so we have our own data sharing agreement with NHS England to access a pseudonymised. So yeah, Ross mentioned that. So it's, we get a version that's pseudonymised, but we can also get other versions, say of SUS heads and other data with the same pseudonymised NHS number. So that's sort of central bit.
Okay.
But there are also ICBs, I think, through sort of sub-licensing agreements, can access CLD as one of the commissioning data sets. NHS, or you know, that is in terms of being able to access the record level data and use it operationally. Again, the pseudonymised data. That is. But you know, so can a wide range of like research organisations, CQC. They haven't yet, but they can set up data sharing agreements to access the data in the future.
That's really helpful. We got secure data environment on our next huddle, so we'll be asking about that. Ross, did you want to add anything on that? We just got like actually we got 1 second.
The only thing that I would add is, and it probably goes without saying, because of the complex nature of that particular data set, it goes without saying we need to do that collaboratively, don't we, as a system, and make sure that health and social care analysts are undertaking that in a collaborative way, so that those local nuances can be understood and considered when undertaking any analysis.
Okay, that's good. I did. There's 1 or 2 questions around, I suppose, the perspective of a social, a current adult social care analyst. I'm thinking there might be some sort of threat to maybe some of the work that they do or the roles that they have. But I'll just leave you with that, you know, because I haven't got time to answer that. I haven't really got time to sort of talk about the what's happening next in terms of Huddle. So you'll just have to go to the website, and everything. All the information you could possibly need will be there. Meanwhile, I would just like to say thank you so much to Ross and to Jenny for coming to talk to us about CLD. Jackie's got her hand up, but I think it might have been a clap. I'm because it's gone so quickly. I think it was yes. She's turned it into a clap. She's converted. She's transformed into a clap. Yeah, so I think that I found that really enjoyable, because I just love to hear some of the detail of what's happening, and you've described it really, really well. So thanks for that. I would just like to say to everybody, thank you for coming, and I would like to wish those of you who celebrate Christmas a very happy Christmas and a fantastic New Year. We do actually have a huddle on the 28th of December, so those of you who are getting a bit bored and a bit too full, come back and let's talk about secure data environments. I mean, that is a fun topic. You cannot deny that. So thanks again, everybody, and I'll go here. I'll go now, and I'll see you all again in a couple of weeks. Have a good Christmas. Bye bye. Bye, Jenny. Bye.